What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had take COVID test, hopefully you have tested negative. If you did test positive during this summer surge of COVID, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, July 17th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. We're going to talk about several different viruses today and some that are just labeled as illness. There's a lot of things going on around the world. There's a lot of things going around. Oftentimes you'll see news do little reports called What's Going Around. Well, I can tell you this much. COVID's still going around. It did not end. It never ended. And it's not going to be ending sometime soon. Sometimes I get the question, do I ever think transmission will be down? I would like to hope at some day we get transmission to come down with COVID. Right now, we're not there. We're in a summer surge in the United States, and there's a surge of COVID going on around other places in the world as well. Many different countries right now are seeing increases in COVID and other viruses. You need to know what's going on. Best way to do that, subscribe down below, give this video a thumbs up, hit that notification bell. It's supposed to notify you when I do my daily updates, and of course, leave a comment down below and just share these videos with anyone you know. Alright, starting off today in Oregon, where it's measles that's a problem. In Multnomah County, where one case of measles has been confirmed, it says, according to Multnomah County officials, the unvaccinated toddler recently spent time abroad in a country where measles is more common. Again, childhood vaccinations are important. You may have seen something on the news the other day or yesterday. We're not going to really talk about it, but you may have seen something on the news where they're not favorable of childhood vaccinations down the line. Forget that. Childhood vaccinations are important. If this child was vaccinated, it might have prevented this case of measles. All right, moving on. Actress Kerry Washington announced on Tuesday, July 16th, 2024, that she will be unable to attend the premiere of Unprisoned Season 2 as she has COVID. Currently, she is 47 years old. This source of information is coming from People magazine. Of course, I did put this case on my website. Moving on to this, Wastewater in the state of Arkansas has revealed a 1,153% increase in COVID-19 from June 8th, 2024 to June 29th, 2024. The level recorded was 11.3. It is still lower than the all-time high detected on January 6, 2024 of 18.6. Wow, that is a big increase in Arkansas for COVID. I'm telling you, the South and the West right now are not doing good at all for COVID. And you know what? The Northeast and the Midwest is playing catch up, and yeah, we're starting to do pretty bad as well, which is not a good thing. Alrighty, we got to talk about the Summer Olympics. They're coming. Ready or not, the Summer Olympics are coming not this Friday, but next Friday on July 26th. And if anyone's been following these videos or been following the Tour de France, you know the Tour de France has turned into a super spreader, not just COVID, illness in general. There have been a lot of people that have dropped out of that. Well, the Summer Olympics. Have you ever watched the opening ceremony? There's a lot of people from all around the world that come out. A lot of athletes, a lot of competitors. There is a pretty good chance the Summer Olympics will have some people dropping out. In fact, already there have been 2 competitors that have dropped out of the summer of 2024 Olympics because of illness. Joanda Neff and Marlon Russer of Switzerland have already withdrew from the competition. They are mountain bike competitors, and they have already withdrew due to illness. One of them, I believe I read, is dealing with breathing difficulty. Wonder where that started, if it started before COVID or after COVID. But yes, there's already 2, and without a doubt in my mind, this list is going to grow and we have the list here. My website is datareport.info. I'll be adding stuff as it comes along. Of course, if I do see a news agency that just posts a big list, we'll also just add that as well, like we did with Tour de France. Maybe eventually I will get those names in. But I do want to show you this. I just took a poll just a little bit ago, and I expect there's going to be a lot of votes from this. In fact, first hour, 295 votes already. Do you think the summer of 2024 Olympics will turn into a super spreader for COVID and illness? And note, I did also include the word illness. They don't always say COVID, and to be fair, it's not always COVID, but in most cases it is COVID this day and age. So do you think it's going to be a super spreader? 97.3% said yes, 2.7% said no, and you can see here a lot of people said yes, unfortunately yes, 100%. Obviously, Tour de France was an appetizer, yes. I mean, have you ever watched the Olympics? There's a lot of people that come out prior to the start of the Olympics. When they do that opening ceremony, there are hundreds, no, thousands of people that come out, athletes from all around the world. Good chance there are going to be cases of COVID or people becoming ill, or maybe complications from people who have dealt with, unfortunately, long COVID. All right, moving on. Taking a look at this now from BNO News. Colorado health officials have given us new details about the 5 human cases of H5N1 bird flu, but they also say this. Another 16 symptomatic workers were tested yesterday. Yes, so more people are being tested. In total, 69 symptomatic workers. 5 of them are positive so far. Test results still pending. Antiviral medication given to 150 workers. So I'm getting concerned. This number could add up. And of course, you got to wonder, do these workers have to go home to their families? Could it spread to their families? And if so, are they being tested? Yes, there's a lot of questions here that we still need to be answered. All right, moving on. We have a ton more things to get through today. COVID-19 update. Cases in Mexico at this time are increasing. And you can see here in Mexico, the percent positive of people testing positive for COVID in Mexico is now reaching up to 28%. Yes, it says here. Meanwhile, the COVID positivity rate, the percentage of people who tested positive for the disease, rose during the 7 consecutive weeks to 28%. So, yeah, that is just totally ridiculous. Take a look at this. This is also ridiculous. Maybe this should be relatively concerning. Maybe it's why we should be protecting the children. COVID tied to faster progression for preclinical type 1 diabetes, from preclinical to clinical type 1 diabetes in kids. So, yes, maybe they were at the very early stages. Well, one case of COVID can really accelerate the pace of that. Sam Bennett forced to withdraw from Tour de France with illness. They do not state whether or not it's COVID. We do know COVID has been present at Tour de France. So there you go. Another note on the Tour de France. Moving on. Bad news. COVID is spiking in Dallas County once again. Now, as we know, Texas, it's not very easy to get data from Texas. They don't require everywhere to report. And it even says in here that Texas stopped mandating the reporting of COVID-19 cases in March. But the Observer recently spoke with a handful of pharmacies across Dallas County that have reported a recent jump in the number of prescriptions written each day for Paxlovid, a medication used to treat COVID, and a number of patients saying they have tested positive for the virus. Yes, and just the other day, I was at a pharmacy. Sometimes I do deliver prescriptions, and I did ask them, are you noticing an increase in the number of prescriptions being filled for Paxlovid? They said yes, they have had more Paxlovid lately. So, very interesting. And that being in Dallas, and where I'm referring to is Southeast Pennsylvania, in particular, Montgomery County. Alrighty, moving on. We do not have an update from the UK today. That's the next thing on my list here. We'll get that hopefully tomorrow. Taking a look at the allergy map at this time. 56% of the country is in low to medium status at this time. We do see a lot of green, but in the north, we do note some yellow, which would be higher shades of allergy levels, pollen levels in the atmosphere. Moving on now to the air quality levels, we do note there is yellow in the east, the northeast, some orange mixed in. That is going to improve over the next couple of days. There is a cold front that's going to move through that area, and we should see some improvement. Where we don't see any improvement right now is on the west coast, where you can see there's a lot of orange, a lot of yellow. Wildfires have started up once again. Heat-related illnesses, that should improve in the Northeast a little bit over the next couple days. You'll get a little bit of a breather because once this front moves through, the humidity level is going to drop. The rest of the country, it's still going to be a problem. And even though I just said it's going to improve in the Northeast, we could still see the coloring fill in a little bit more in places like Pennsylvania, where there have been a lot of heat-related illness calls over the last couple of days. We'll show you Philadelphia in just a moment. Want to learn more about climate and the weather? Check me out over at Climate Data Report on X and on YouTube. Eventually, I will get something on that other YouTube channel. Speaking of Philadelphia, here you go. 905 EMS calls reported on Tuesday. Yeah, that's a really high number. It's not a number we're happy about at all. It was really hot yesterday. My home weather station said the heat index here was 111 yesterday. I'm looking right now. Wow, it's currently 109 heat index with an air temperature of 97 outside. High humidity, high heat index, high dew points. Breathing difficulty problems will occur. Happened with me this morning. No, I didn't need to call EMS, but yeah, my asthma was acting up this morning. It's uncontrollable when it gets this hot. Luckily, we do have air conditioning. As soon as I'm done with this, it's going right back on. Obviously, I have to shut it off when recording. It's just too noisy. But yeah, 905 EMS incidents. Take a look at this. Wow, Montgomery County is getting slammed right now with EMS calls. This is in southeast Pennsylvania. You can see here a lot of various different calls. Hopefully we can see Chester County. We might not be able to because we had some really bad thunderstorms last night, which actually at one point crashed our dashboard for CAD. And let's see here. Nope, still can't see it. I'm telling you, both of these counties were just loaded with trees and wires down. Dozens and dozens of calls for that at one point last night. It's going to happen again today. Pennsylvania in general, in the northwest portion of the state and the southeast portion of the state, is starting to see increases for COVID once again. Walgreens this week, the positivity rate is 39.2%. Total test, 6,767. That's the highest number of tests reported in quite some time. And it just shows you, hey, people are going out to get tested. Why? Because people are feeling sick. COVID is on the rise in the United States and will continue to rise for at least a few more weeks. And at some point, it will eventually peak up in Canada at this time. Let's refresh this. The viral activity level of COVID is in the high category. The viral activity level of flu A is moderate. Flu B is not detected. And RSV apparently is detected, though in very small numbers. It is coming in at low at this time. The national wastewater for COVID in the United States at this time is coming in at high levels in the United States. Let's take a look at a couple of those wastewater sites, shall we? And I think we're going to go up to Maine today. I want to know what's going on in Portland, Maine. Can we see? Oh my. And we see multiple updates, though some of them are wonky. We do note that Portland, Maine is seeing a rapid increase for COVID at this time. Wow, that is relatively concerning to see it rising that much. I mean, usually you get the wonky movement, but that is really going up. Let's take a look at Boston while we're at it. What's going on there? Boston was going up, and it still is going up slightly. Again, we note there is a wonky movement. That will get corrected as well. I think even Portland will probably get corrected at least a little bit. Let's go down here near DC, and let's see what this wastewater site is showing. Never mind. Has not updated since June 3rd. Interesting to see DC being shown on the map at this time. How about we go down to northwest of Houston? We talked about Dallas. What's going on northwest of Houston? And there was an increase for COVID. And this is at the Woodlands wastewater facility. 70,000 population. Yeah, it's listed as high, but it does appear over multiple updates it is dropping at that wastewater site at this time. That is good to see. And let's go out to California. How about we go to Sacramento? We have not looked at Sacramento in quite some time, and Sacramento has been seeing an increase for COVID. It is listed at medium at this time. Alrighty, the latest variant of COVID at this time is the KP.3 variant at 36.9%, KP.2 is at 24.4%, and LB.1 is at 14.9%. I expect there will be a variant update again on Friday. Taking a look now, what's going on with epidemic status, it's growing or likely growing across the majority of the country at this point, and only stable, uncertain, or not estimated in just a few countries. All of the Southeast this time is growing. Almost all the Mid-Atlantic and the majority of the Northeast is growing or likely growing. Southwest U.S., similar deal. You get the idea here. We're in a wave in the United States. Epidemic status goes up when COVID goes up. Taking a look at New Jersey today, or well, we'll say hopefully taking a look at New Jersey. It's been coming up listed as no data all day. Again, every day comes up with something different going on in New Jersey. 70 out of 70 hospitals reporting, but it says no data. Eventually this chart does load with a number from several days ago. I don't know what the deal is with New Jersey. New York State, 1,256 cases added. That would be ever so slightly less than last week, I think. That's a good thing. Hospitalizations, still higher than at any point from last week, but down from yesterday. 1,043 people in the hospital and 95 people in the ICU. The long-term trend in New York State since about late May, or we'll call it early June, has been upward, and I expect that's probably going to continue at least for a little while longer. At some point, we will see a peak in New York State. Taking a look now at a place we have not looked at in some time, and I did have this up here, that would be Florida. And what happened to my Florida tab here? Here we go. Let's see what's going on in Florida. Florida has been seeing a lot of cases of COVID, and that has not been getting any better. Here we go. Here's Florida. And let's see, statewide level for cases at this time, they have 247,395 cases for the year. Nearly, not far off from half of their number of last year. Will they get to more cases than last year? Hard to say, because the South and the West will be one of the first places to peak for COVID. So I suspect probably by first week in August, or at some point in early August, I think that's probably when Florida will be peaking. But hey, their number is getting up there. 247,000 reported cases already. Mind you, a lot of people do not report their case, the at-home test, or just simply do not test at all. Let's see. How many deaths has Florida had this year? Hopefully that will come up. And there we go. It is coming up. So far this year in Florida, 2,994 deaths have been reported. So yes, deaths are still a thing. Last year, in case you're wondering, they had 8,438 deaths. I don't think they'll be getting to that number unless some new variant comes in or something changes. But as of right now, again, hey, almost 3,000 deaths. That's a pretty high number still. It goes to show you, COVID's not over. Florida, nearly 3,000 people have died of COVID this year. And it would be interesting to see how many of them were vaccinated or unvaccinated. Just curiosity has got the better of me with that. Alrighty, folks, that does it for the Wednesday edition of the Pandemic Update. Whew, that was a lot of news we went through today, wasn't it? Well, I hope you feel informed now. I hope you know what's going on and that, hey, this is a pretty serious deal. COVID's still going on. Measles, H5N1, all these other viruses, they are a real threat to you. You need to be aware of what's going on. If you like this video, give it a thumbs up. You want to stay aware, want to continue to be informed, subscribe down below. We do this every day. Hit that notification bell, share this with anyone you know, and leave a comment down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.